Hello, I'm Dr. David Roberts from Manchester West Veterinary Hospital, and I'm here with Fluffy, and she is an 8-week-old kitten, but she's going to grow up and she's going to be an adult someday. And what we're going to find is that cats, just like dogs and just like people, they do get arthritis. So today's topic is going to be on arthritic changes in cats. When we start looking at cats and their growth process, we didn't really pay much attention to it back in the day with arthritic changes. As we have evolved as veterinarians, we now know, and there were studies done in some of our major journals that actually prove cats do get arthritis. And the two top spots we're going to show you are going to be the lower back, the lumbar spine, and the elbow. And it's probably because of the cat jumping and its mobility and its agility type of thing that starts to create arthritis and changes in those joints. So when we see a cat that's having a hard time getting up on the bed or jumping off of the couch or what have you, the next thing we actually start to do is looking at x-rays, because we want to make sure we know what's going on. So when we look at the elbow, we're going to start off with a little picture of what we see. On this side, it's a nice, normal, smooth bone side view of an elbow. But on this view, we see, again, the kind of lumpiness, and that is arthritic changes. And that's what we find with arthritis in our feline patients. When we look for that, we'll take an x-ray. When we go to our radiographs here, we're going to show you a picture of about a 10-year-old kitty cat, and this is the elbow. Kitty is lying on its side, and the elbow is pulled back, but all of this white scarring are bone spurs, and they are showing us that this kitty has arthritis. We have another spot, as we talked about, in the feline patient. The most common, second most common, is related to right here, the lower back. This is where the spine or the backbone meets up with the hips. So what we find is right here at the end of that, there's a very complex joint. And we'll show you a radiograph of that shows a kitty cat that has arthritis in its lower back. What we find is that, again, is a side view. That's the tail. Those are the back legs. And what we're finding are these little lips, these little bone spurs. And we actually can look at this and say that is nice and clean. That one has a few little lips. This one has a lot, and it also has bone scarring on the end of these vertebrae, and it's actually also compressed. So that tells us that kitty has arthritic changes there. When we go to, once we have a diagnosis, we have different options. When I look at an elbow, or even in a canine patient with a hip or something, we go to a drug called Adequan. And this will show a canine, a dog on the picture, but it is not FDA approved in cats, but we use it pretty much on a weekly basis. And it actually works very, very well to reconstruct or give back the cartilage in the joint of a feline patient. So for the elbow, that is actually a wonderful product. The other thing that we'll use for lower back conditions is we'll use a product that's an enzyme. It's called superoxide dismutase, which is doctor terms for SOD. But it's an enzyme that helps remove some of the molecules that create arthritis. So it really gets down to the source. When we have a kitty cat that's bad and is having a real hard time getting around, we do have to go to a non-steroidal type of drug. And we use Metacam or Meloxicam, and it is FDA approved for use in cats as an injection, not so much as an oral, but we use it for cats as an oral medication to try to give them relief from their arthritis. Sometimes we can get by with just every other day, and the cats do very, very well. So arthritis in cats is starting to catch on, or it's starting to at least be discovered and investigated, and we now know how to do treatments, diagnostics, we know where the hot spots are, and that's what we're looking for with our feline patients. I'm Dr. David Roberts from Manchester West Veterinary Hospital. Thanks again for tuning in.